Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. The fundamentals are not rocket science. It's universal wearing of masks. The issue in that is to make sure you do whatever you can to safeguard the safety and the health of the children as well as the teachers. Close the bars and keep the schools open.
A lot of folks are hearing now about double masking, wearing 2 masks or trying to get one of those N95 medical grade masks.
You know, it likely does because, I mean, this is a physical covering to prevent droplets and virus to get in. So if you have a physical covering with one layer, you put another layer on, it just makes common sense that it likely would be more effective. And that's the reason why you see people either double masking or doing a version of an N95. There are many people who feel, you know, if you really want to have an extra little bit of protection, maybe I should put 2 masks on. There's nothing wrong with that, but there's no data that indicates that that is going to make a difference.
Wanted to bring you some pretty stunning comments from Dr. Anthony Fauci, who basically just admitted why and how the government lied to us about the efficacy of wearing masks. Let's take a listen as he explains the real reason they told us not to do that.
What about a month or so, or 2 or 3 ago, when people were saying, you don't really need to wear a mask? Well, the reason for that is that we were concerned, the public health community, and many people were saying this, were concerned that it was at a time when personal protective equipment, including the N95 masks and the surgical masks, were in very short supply.
It is
just hard. A lot on live television.
Yeah, it's insane. Hard to overstate how outrageous it is.
Anthony Fauci admitted to the New York Times he'd nudged the numbers on herd immunity up to bolster public support for COVID vaccines.
The estimate is that you'll need about 70%, maybe 75% of the people in the country vaccinating to get that umbrella of herd immunity. Let's say we get 75%, 80% of the population vaccinated. We may actually have enough herd immunity protecting our society. You can make an extrapolation from other infections. I say between 75 and 85% of the population.
When newer surveys said 60% or more would take it, I thought I can nudge this up a bit. So I went to 80, 85. We really don't know what the real number is. I think the real range is somewhere between 70 to 90%, but I'm not going to say 90%.
Clear to them that the vaccine is the ticket back to pre-pandemic life. And the window to do that is really narrowing. I mean, you were mentioning, Chris, about how all these states are reopening. They're reopening at 100%. And we have a very narrow window to tie reopening policy to vaccination status. Because otherwise, if everything is reopened, then what's the carrot going to be? How are we going to incentivize people to actually get the vaccine? So that's why I think the CDC and the Biden administration needs to come out a lot bolder and say, if you're vaccinated, you can do all these things. Here are all these freedoms that you have. Because otherwise, people are going to go out and enjoy these freedoms anyway.
I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
If someone dies with COVID-19, we are counting that as a COVID-19 death.
In partnership with CDC and state and local governments, utilizing the surveillance systems that are available, what we just talked about, the flu surveillance system, because we no longer have flu.
Do we have enough infrastructure to contact trace the way that we need to?
I think that's why the criteria that you can see the gates that are that the federal government has recommended. I think that's why the criteria that you can see the gates that are that the federal government has recommended. The gates that are the gates that are the gates that are that the federal government has recommended.
I'm not asking what's in the infusion. I'm not looking up all of the ingredients in the infusion. I am sticking out my arm and I am taking the infusion. And that's what we have to do.
Also to say to everyone, you should come to Chinatown. Precautions have been taken by our city. It's exciting to be here, especially at this time, to be able to be unified with our community. We want to be vigilant about what it might be on what is out there in other places. We want to be careful about how we deal with it, but we do want to say to people, come to Chinatown. Here we are. We're, again, careful, safe, and come join us.